What is the difference between the stage and the grade of the tumor? I was told that my cancer is grade 3, and is that the same as stage 3? This is one of the most common confusion when patients are told of their cancer diagnosis. Are they the same? And what do they actually mean? In this video, I will be explaining to you the difference between the grade of the tumor and the stage of the tumor. Grade of the breast cancer tells us how active the cancer cells are growing. So remember, grade equals to growth rate. When you first received your biopsy report, you will be informed of the type of breast cancer. Example, invasive ductal cancer or lobular cancer. And often, the grade of the tumor will be included in the report. It's one of the prognostic indicators that tells us how active the cancer cells are dividing and changing. From the tissue that was biopsied, the pathologist will study the sample under the microscope and will score the appearance of the cancer cells according to a Bloom-Richardson grading system. There are 3 grades. Grade 1, which is low grade or well differentiated. Grade 2 is intermediate grade or moderately differentiated. And grade 3, which is fast-growing or high-grade and poorly differentiated. Now, grade 1, the cells are more uniform, they are round and more normal-looking with low mitotic activity. Low mitotic activity means they are growing slowly. These cancer cells resemble normal cells and are less likely to spread. In grade 2, the cells start to look more abnormal and out of shape and not uniform with higher mitotic activity. And in grade 3, the cells look irregular, bizarre, disorganized with high activity count, and they are more fast-growing. Sometimes, these cells will be described as necrosis, and this means that the cells are dead and dying. Comedo necrosis are often reported in high-grade DCIS, means that the cancer cells inside the duct is dying or dead cells, and this means that it is a higher chance of developing into invasive breast cancer. What does a stage of breast cancer mean? Stage of breast cancer looks at where the cancer has spread to other parts of the body. So remember, staging equals to spread. How does breast cancer cells spread? The cancer cells typically starts within the breast ducts, lobules or connective tissue. It will start to grow and divide abnormally and invades out of the wall and will spread or travel via the blood vessels or the lymphatic channels to other parts of the body. From the lymphatic channels, it can spread to the axillary nodes first, then to the other nodes in the neck, the internal mammary nodes. Whereas if it spread to the blood vessels, it can spread to commonly the lungs, liver, bone, and even the brain. These are most of the common organs or areas that the breast cancer can spread to. How to determine the stage of the breast cancer? It is assessed by considering the size of the tumor, which is T, the spread of the cancer cells to the lymph nodes in the armpit, which is N, and the spread to the cells of the other parts of body, which is M. M stands for metastasis. There are 2 common types of staging described, which is the TNM staging as well as the AJCC staging. TNM staging stands for T, the size of the tumor, N, which is the number of nodes involved, and M, metastasis of the cancer to the other organs. AJCC staging is categorized into the stage 1, 2, 3, or 4, and this is more commonly used. Now, the stage of the breast cancer are classified according to TNM. Stage 0 is a pre-invasive cancer or the non-invasive cancer, or is also known as cancer in situ. If it's stage 1, it means that the cancer is still within the breast, or the size of the tumor is less than 2 centimeters. If it is stage 2, the size of the tumor is between 2 to 5 centimeter and it can also spread to the axillary nodes. If it is stage 3, the size of the tumor is normally more than 5 centimeter and there are more nodes involved. And if it's stage 4, there is a spread of the cancer to the other organs. Why is the grade and stage of the breast cancer important? Generally, both the grade and stage of the breast cancer help us decide how aggressive the cancer is likely to be and what treatment options will be given. Example, for grade 3 tumor, chemotherapy are more likely to be offered compared to grade 1 or grade 2 tumor. Grade and stage alone will not determine the treatment options, but together with other prognostic indicators, it plays an important role to determine the overall treatment for breast cancer. Example, if local treatment is enough or systemic treatment will be further advised. So in summary, the differences between the grade and the stage of the breast cancer: the grade tells us how fast and aggressive the cancer cells will grow. Grade equals to growth. So remember, there's grade 1, 2, and 3. And the stage tells us where the cancer cells will spread to. Stage equals to spread, and stage will be 1, 2, 3, or 4. Check out this video to learn more.